What could be a big breakthrough in cancer treatment was announced today. Researchers have learned how to replicate individual cancer cells and then keep them alive in the lab. The researchers from Georgetown University say this is going to allow a variety of cancer drugs to be tested in laboratory settings on actual cells rather than having to do clinical trials on the human population. And that could allow a more personalized chemotherapy treatment to attack specific types of cancer cells. I talked to oncologist Dr. Robert McInerney from Rational Therapeutics, it's in Long Beach, about what that could mean for treatments.
I think we're realizing that cancer cells are often more alike than different. So a cancer may come from the colon but behave like a cancer from the lung or breast. On the flip side of the coin, there are now treatments for cancers of the breast that might have originally started off as treatments for pancreas. So what we're realizing is that there are pathways and there are changes in cells that aren't necessarily driven by where the cell came from, but are driven by that cell's particular unique fingerprint.
And how long does it take to take that fingerprint?
For us to do the study, it's approximately 3 to 4 days. We like to get a snapshot. The way I would see the Georgetown study is they've painted a perfect reproduction of the Mona Lisa. I want one of those snapshot cameras. I just want to grab a hold of that cell, get a feel for what it's going to do under conditions of drugs and exposures, and then report it to a patient in real time. It's a real-time process that gives patients useful clinical information.
And you apply the drugs to these cells, is that correct?
Exactly.
To see how the cells are affected by them. Can you also tell what type of adverse effects there might be?
Unfortunately not. To some degree, in a developmental way, we can. We can take cells like normal cells, expose them to drugs, and see if the drugs are poisons. And if they kill normal cells without any differentiation between cancer and non-cancer, you can assess that is probably a toxin. But beyond that, I can't exactly tell you whether a drug is going to be causing nausea or hair loss or a particular side effect. That's something that really we still have to do the basic clinical trials for.
And I want to correct myself. I mispronounced the doctor's name. It's Dr. Nagurney. And one of the things he said that is interesting about this is that he is finally being, somewhat vindicated because he's been doing this research by testing these drugs in the Petri dishes for a long time. And other physicians go, nah. Well, now that Georgetown has come out and said, we can keep cancer cells alive and we can do this stuff ongoing for years on cancer cells, it's really going to open up that type of treatment.
Did he say where it stands beyond the research right now? I mean, how widely can this be applied?
Well, it can be applied because in his practice, he actually prepares his own cocktail for your particular type of cancer. Mm-hmm. And just because you may have, a person may have breast cancer, he says the cells in that breast cancer may really resemble more like pancreatic cancer. So just because they happen to exist in a certain place in the body, he doesn't just automatically rubber stamp a protocol and says, that's breast cancer.
Regardless of what it is and whether it works, it's certainly pointing toward the evolution of how we're treating cancer now. And we've seen the evolution in heart disease. Maybe we see an evolution now with cancer. And the mortality rates go down.
Without
and we live
doubt.
there's a belief in the medical world, you live long enough, you do get a form of cancer. Mm-hmm. So we'll all have something one day.
Yep, no doubt about it.